In this video, we're going to go over the biomechanics of the SC joint with the scapular motions. Okay, so the four scapular motions that we have, this is all rooted in PNF, is we have anterior elevation, posterior depression. All right, we also have anterior depression, posterior elevation. All right, and these motions couple with the actual arm motions in some of the other videos that we've formed. Okay, so anterior elevation couples with flexion adduction of the arm. Posterior depression couples with extension abduction of the arm. All right. Anterior depression couples with extension adduction of the arm, and posterior elevation couples with flexion abduction of the arm. Okay. So now, what happens at the SC joint with each of these four diagonals of the scapula, or each of these two diagonals in both directions of the scapula? So as we go into anterior elevation, the scapula is the clavicle is moving inferior and compressing. Okay, so we're moving up and forward, inferior compressing. As we move into posterior depression, it's doing the opposite of that. Okay, so it's moving superior and decompressing. Okay, so it's moving this way. Anterior elevation, down and in, posterior depression, up and out. Okay, it's actually perpendicular to this diagonal. All right, now if we move into anterior depression, we move into here, the scapula is moving down and across the body, right? So the clavicle should be moving superior and compressing, all right? So it should be moving that way. And then the opposite should be true if we're coming into posterior elevation. The clavicle is moving down and away from her body. Okay? So it's the exact same as if we were using the arms. You just have to know which scapular pattern goes with which shoulder pattern so that you can assess appropriately the infield of the clavicle.